In this video, I will inform you about the causes and remedies of renal stenosis, based as always only on scientific data ascertained by the most experts in the field. Causes and remedies of renal stenosis. Hi, I'm Dr. Manu, and this channel is all about health and wellness. I help you by providing certified scientific information in a simple and cohesive way. Now, let's dive right in. What is renal stenosis, and what are the symptoms? Renal stenosis, also sometimes called renal artery stenosis, is a condition that consists of the progressive narrowing of the arteries that carry blood to the kidneys. This causes a series of symptoms that worsen over time, including continued high blood pressure, which is called hypertension, despite taking medications to help lower it, fluid retention, which in turn can cause nausea, persistent coughing, edema, which is swelling and fatigue, decreased kidney function, which can lead to a buildup of toxins and impurities in the blood, and can cause anemia, i.e., too low iron levels in the blood. Also, it can make you feel tired, weak, and can make it hard to concentrate. Ultimately, artery stenosis causes an increase of proteins in your urine, which can give you symptoms of nausea, vomiting, and muscle cramps at night. What are the causes and risk factors of renal stenosis? Renal stenosis is primarily caused by a buildup of cholesterol and trans, saturated and unsaturated fatty acids. This process, called atherosclerosis, causes damage to the blood vessels. It inflames them, stiffens them, and reduces the flow of blood that passes. More than 90% of the time, renal artery stenosis is caused by atherosclerosis. The pressure exerted from the outside towards the blood vessels can rarely be the cause. In fibromuscular dysplasia, the muscles press against the arteries. In vasculitis, the accumulation of fluids presses against the arteries. And in neurofibromatosis, it is the growth of nerve or tumor tissue, which presses against the arteries. The risk factors are the same between men and women: a diet high in fat, sodium, and sugar, diabetes, family history of heart disease, high cholesterol, obesity, sedentary lifestyle, or a lack of exercise, and smoking. Complications of renal stenosis. The complications due to this condition are a worsening of the symptoms already listed above. In particular, the swelling and the accumulation of fluids can also affect the lungs, leading to a very serious condition called flash pulmonary edema. Other common complications are the further increase in blood pressure and damage to kidney tissue, which over time can lead to kidney failure. If an advanced stage of kidney damage is reached, a kidney transplant or periodic lifelong dialysis is required to stay alive. What are the remedies for renal stenosis? Starting with medications, doctors usually prescribe angiotensin II receptor blockers, calcium channel blockers, and angiotensin-converting enzyme inhibitors. These drugs help relax blood vessel walls and lower blood pressure. Your doctor may also recommend diuretics to reduce swelling and fluid retention. Even if you take all the required and recommended medications, the worsening of this condition is not stopped at most. It could just be slowed down a bit. This is because the drugs act on some symptoms, but do not touch the causes of why the condition has occurred. If you make lifestyle changes in addition to medication, your well-being will improve exponentially, and there is a chance that you may reverse the condition. As we have said, atherosclerosis, which reduces the volume of blood passing into the blood vessels, consists mostly of trans fat, saturated fat, and cholesterol. With the proper diet, the plaques that have formed can gradually disintegrate, and the arteries can return to being cleaner and more functional. Specifically, the recommendations in terms of lifestyle are: eliminate or reduce dietary cholesterol. Don't worry, all the cholesterol that we need is produced by the liver. Eliminate or reduce trans fat, which we don't need at all, and reduce but not eliminate saturated fat. Increase the intake of vegetables, especially green leafy ones, and increase the amount of antioxidants and phytonutrients taken. A diet in which you keep the unhealthy foods and simply add a few more vegetables or fruits is definitely not enough, according to research. In addition, the amount of salt must be reduced and adequate body weight must be achieved or maintained. The most scientifically effective diet to achieve and maintain all these results is the whole food plant-based diet. The reason is simple: since they are not processed, whole plant foods retain their dietary fibers, and their nutritional supply fill the stomach more due to the amount of water and fiber they contain, and have equal to the weight, fewer calories than animal and processed products. They also contain antioxidants that are very valuable for health. A whole food, plant-based diet also has positive effects on so many other health conditions. Exercise. Physical exercise is another contributing factor to the reduction of atherosclerosis and consequently improves the symptoms of renal stenosis. Both aerobic and resistance exercise can help fight atherosclerosis by reducing the amount of fat in your blood, lowering your resting rate blood pressure, LDL, the bad cholesterol, improving insulin sensitivity, and controlling your weight. Aerobic exercise is more specific for improving lung capacity, while resistance training is more specific for improving endothelial function, i.e., the inner walls of blood vessels, and increases physical strength. Both work, but the best results have been achieved with a combination of both exercise modalities. The recommendation is to have at least 150 minutes of moderate aerobic exercise per week. The authorities have not set an upper limit for the simple reason that, from their studies, every increase in aerobic exercise performed linearly reduces mortality from all causes. Smoking. The chemicals you inhale when you smoke, even passive smoking, causes damage to your heart and blood vessels that make you more likely to develop atherosclerosis or to worsen the condition of already present plaques. Alcohol. Even if when alcohol is initially in the circulation, it is a vasodilator and temporarily increases the volume of blood vessels, its effects are deleterious for them in the medium and long term. Alcohol, after a short drop, subsequently increases blood pressure, reduces endothelial function, that is, of the blood vessel walls, and increases heart rate by disturbing the electrical signals that produce a heartbeat. Moreover, alcohol consumption can raise the levels of fat in the blood and increase the progression of plaque accumulation. And these are only the direct effects it produces on the cardiovascular system. Alcohol also has a whole host of other negative health effects. The common belief that drinking in moderation is good for the heart is the result of marketing and studies in which a correlation but not causation has been observed between risk and its predisposing factors. The correlation derives from the fact that those who drink little alcohol usually tend to be wealthier, more educated, smoke less, live in nicer areas, are less likely to have been in prison, and are less likely to be overweight. In subsequent studies in which the variables were adequately isolated, it was found that eliminating alcohol altogether produces more positive effects than simply reducing it. The so-called positive effects attributed to it have disappeared. In fact, the prestigious scientific journal The Lancet concluded in 2018 after a collection of world studies on alcohol consumption, I quote, "The safest level of drinking is none." Caffeine. Drinking beverages that contain caffeine is linked to higher levels of cholesterol. Furthermore, caffeine has been shown to make arteries stiff, which contributes to coronary artery disease or hardening of the arteries as we age. Salt intake. Unfortunately, in this society, almost all processed foods contain too much salt. Sometimes even sweets contain added salt to enhance the contrast of flavors. Taking too much salt causes high blood pressure, increases the mass of the left ventricle, leading to heart failure over time, thickens and stiffens conduit arteries, and thickens and narrows resistance arteries, including the coronary and renal arteries. It also increases the number of strokes, the severity of the cardiac failure, and the tendency for platelets to aggregate. Stress. Chronic psychological stress can increase the risk of atherosclerotic diseases, including strokes and heart attacks. Chronic stress is pervasive during negative life events and can lead to the formation of plaque in the arteries. Learning techniques that facilitate relaxation, such as deep breathing, meditation, tai chi, and yoga, can be effective. Taking long walks in nature, listening to relaxing music, getting a massage, and taking a moderate temperature bath can also be added methods. Oxidative stress. There is not only event-induced stress but also physiological stress induced by free radicals, called oxidative stress. When the amount of free radicals in the body is not sufficiently counterbalanced by an equal or greater amount of antioxidants, the body ages prematurely, and many diseases develop or increase in their progression. By increasing the antioxidants taken through food, cardiovascular parameters are also improved, such as atherosclerosis, the amount of cholesterol and saturated fat in the blood, and endothelial function through their anti-inflammatory powers. Finally, the latest help to combat renal stenosis through lifestyle is to get the recommended 8 hours of sleep per day. Researchers already know that poor sleep or low-quality sleep plays an important role in predisposing a person to cardiovascular disease, diabetes, dementia, obesity, depression, cancer, and even kidney disease. Dr. McMullen of the National Kidney Foundation says, I quote, "Kidney function is actually regulated by the sleep-wake cycle. It helps coordinate the kidney's workload over 24 hours. We also note that nocturnal patterns can affect chronic kidney disease and that people who sleep less usually have faster kidney function decline." Most people underestimate how important sleep is. If you chronically sleep less than 8 hours a day, despite your lifestyle, or if you suffer from sleep disorders such as snoring and sleep apnea, it is recommended that you consult a doctor who specializes in sleep and sleep disorders. Below in the description, associated with this number, you will find the link to a questionnaire that has been developed by sleep researchers that will allow you to determine your degree of sleep fulfillment. It is called SATED, it is easy to complete, and contains only 5 simple questions. What about supplements? Regarding this specific vascular condition, a supplement capable of giving beneficial effects has not yet been found. Several supplements have been found that, instead, increases the risk of diseases to the circulatory system, such as taking calcium supplements plus vitamin D, beta-carotene supplements, and omega-3 from fish oil. In conclusion, whether you want to prevent kidney stenosis or treat it, by reducing its symptoms and potentially reversing it, adopting a healthy lifestyle is the best solution. If you like this video, don't forget to like, subscribe, and hit the notification bell to stay up to date on new content. Thanks for watching.